Jen, I just want to thank you for coming here today to kind of go over the deep bleaching program, which I know you've gone through. But just people who are listening to this don't know too much about the case. So if you can just give some background as to, why you decided to go through deep bleaching and, some of your own experiences with it.
Well, the main reason that I decided to do the deep bleaching, I was getting married, and I had tried other things in the past, and they didn't really work. And you had talked to me about the deep bleaching that you do, and I trusted you, so I tried it, and I'm so glad that I did.
Now, when you went through the program, I know there was a time when there was some, in the beginning, when there was some sensitivity. Just talk about that a little bit, because I know a lot of people have questions about the bleaching technique and the sensitivity that it can cause.
In the first week, I had a little bit of sensitivity, and then you had prescribed the toothpaste, and within a day or two, the sensitivity was gone. In general, my teeth can be sensitive, so it was something to be expected, but with the toothpaste, it was resolved.
Okay. Now, I think one of the things, I know which we talked about, was I knew you were getting married, so there was a time element that we had to honor. And some, I think, brides may not realize, because they've got so many other things, I'm sure as you did, you have, so many other things to plan that, exactly when are you going to have your teeth bleached, it may not be at the top of the list. But there is some time, you need some lead time, I guess, to do that. So, I think from the way that the technique starts until it finishes, I think it's about a month. So, I think, probably like at least 6 weeks, I think, would be reasonable to at least get the program going, so that it'll be all finished by the time, that the big day arises. Did you find that to be?
Yeah, I think I gave myself less than 2 months, and I was well within the time to finish before the wedding. So.
Okay. And as far as like, when you were here, when you spent time in the chair to do, the technique, did you find that to be, annoying at any point, or was there something about it that you thought was, maybe a negative?
No, the time that I spent here was no more than a regular appointment, I would say, and it wasn't uncomfortable or anything.
Now, as far as the touching, they recommend that you follow up with a touch-up, once a month. Is that something that you've been doing?
I haven't done it yet, but I do plan to do the once a month touch-up that they recommend. But they've stayed white like when I first got them done. So.
Oh, that's great. That, even though that's not what they recommend, but it's been good that it's. And Jen, I have to ask you this question. I know it's none of my business, but when you do, I don't know if you do any of these things, but I have to ask you because I have an inquiring mind. But as far as coffee drinking or tea drinking or drinking wine, is that something that that you normally do?
Yes, actually, I do drink all of those things. Not the coffee normally, yes.
Well, okay, so that's good. So because those are things that are major. Those and blueberries usually are the things that really can discolor your teeth. And when most people talk about bleaching, they feel they have to avoid that. But you've actually not avoided those things, haven't really touched up. This is like the remedial program. This is not what they want when they talk about technique. But in essence, you really haven't done some of those things, but still the result has still been true to the time, when we finished it. So, that's great that it worked out that way. But Jen, we're still encouraging you to touch them up once a month.
And I will.
Okay. I just want to say thank you again for coming and doing this, and hopefully, there will be people out there who, will pick up something from this, and if they find that it would be a benefit, that they would look us up and maybe consider doing deep bleaching.
Well, thank you so much for having me, and I will definitely recommend it to anybody that asks me why my teeth are so white, which has happened
Okay,
on
great.
several occasions.
That's great. Now, do you want to talk about Steve?